classic signs of autism spectrum conditions. The first one is a difficulty understanding other people, and that's the social communication. Sometimes autistic people can find it really hard understanding other people and the thoughts, the feelings and intentions behind other people's motives. And on the other hand, it can be really difficult for other people to understand autistic people, and so often we can feel quite misunderstood. The second is that we can feel quite anxious in social situations. I know anxiety is one of the most common concurrent conditions that go alongside autism spectrum conditions. The third is difficulty making friends, and often as a result of that we prefer solitude. So most of us prefer, obviously not all because it's a spectrum, so autism affects us all differently, but the vast majority of autistic people prefer to spend time on our own in comparison to around other people. The next one is seemingly coming across as being very blunt or rude, and that's because we're quite literal thinkers, and so as a result we'll give quite literal responses back. For example, if someone was to ask me, does my bum look big in this dress, and I think it does, then I'm going to say, yes, I'm so sorry, I think it does look big. I probably won't even say I'm so sorry, I'm just saying it for this video. I'll just give somebody a direct answer, and that can often alienate us from people, because people think we're being quite rude or unforgiving, when actually it's just because we're quite literal thinkers, so we're going to say exactly what we think. The next one is finding it really hard to express how we're thinking or feeling, and I think this one really affects me, especially if I go to the doctors or somebody's asking me loads of questions or personal questions. Oftentimes I don't understand how I'm thinking and feeling the vast majority of the time anyway, so when somebody asks me that question, especially when I don't know the question's going to be answered and it's spontaneously asked to me, it often, I hit a little bit of a brick wall and I don't know how to respond, and my mind seems to sort of go blank. I don't often know how I feel most of the time myself, so answering that to other people can be quite difficult. The next one is a fondness for routine and ritual. I think the vast majority of autistic people, we have to have things planned out in our days, in our weeks, in our months, in our years. We like to have nothing spontaneous occurring, and we like to know exactly where we're up to in life. And we get really anxious if things can change at the last minute, or if something unpredictable or something unexpected occurs. We can often find it really hard to know what to talk about and know when to interrupt other people, and again that can really alienate us from other people, because we can come across as quite rude because we're interrupting people. And often a lot of autistic people, we dislike eye contact. It can cause a lot of anxiety, and we can often get into people's personal space, or on the other hand, autistic people don't like other people to get into our personal space too much. We find it a little bit too much, and we like to have solitude and sort of be on our own. And as a result, often autistic people, we dislike hugging and close contact. I know a lot of people come up to me and they'll hug me and I'll reciprocate and I'll hug them back. Doesn't mean to say that I like it. I find it quite too much in my personal space, too much sensory overload, too much squeezing, too much pressure, and I find it I dislike it quite a lot. And we have to pre-plan. Coming back to routine and ritual, pre-planning in advance is often essential for autistic people. We often have really specific special interests, and an interest to somebody without autism could be anything. An autistic person might take that same interest that the non-autistic has, and we might take it to the extreme, and we'll learn everything we can about that specific subject, and it can often lead to something called obsessions and compulsions. Autistic women might do something called autistic masking or autistic camouflaging, and that's where we put an act on and we fake our way through life in order to fit in and come across as being non-autistic. And we find it really hard to talk about our feelings. Often we'll hide how we're truly feeling from other people. If we're feeling, for example, where we might tell somebody that we're feeling fine, and we may, as a result, appear to cope okay when actually we're struggling, and that comes back to the autistic masking mechanism. And so as a result, it can be really hard to actually identify whether somebody that is female who's presenting to like a psychologist is indeed on the autism spectrum. Hope you guys have enjoyed this video. If you have, please consider hitting like, commenting and subscribing, and I shall see you next time for my next vlog. Bye!